there's an interesting concept called nurturing care. Nurturing care or nurturing interactions are crucial to mitigating early risks in infancy. Nurturing care provides the essential care that allows children to not just survive, but to thrive. And a developing brain is activated and patterned by nurturing care given by responsible adults. But what do we mean by nurturing care? There's more to it than just the attachment relationship or the attunement that a mother may have with the child. It is the attentive responses that other adults give to a young child in its efforts to connect with the world, to explore and to learn. And it also involves efforts to present the child with age-appropriate stimulating learning opportunities. And why we're interested in this is because we realize that there is more to trusting adults than a mum providing just essential care. And to that we speak to the role of caregivers other than the primary caregiver in the relationship with the developing baby. That might be the father, the grandparent, a nanny, it could be a significant same-sex partner, anyone essentially who a baby has as an alternative to their primary caregiver that is able to provide a trusting environment that is consistent, that is empathic, that is reliable, and that is understanding. If we had to focus a little bit more on fathers, very often we have fathers almost demoted to a secondary role. And we really need to think about it in terms of the message that that sends to the developing baby. Fathers can play a crucial role in ensuring that a baby gets a balanced and empathic caregiving environment. Very often, moms or the primary caregivers who may be another father or another grandparent may be overwhelmed, may suffer from a significant mental illness, may be anxious, or practically may need to go to work. And the concern is, could a baby get the same amount of stimulation, love, and care from another caregiver? And the short answer to that is yes. Babies need to rely on people. They need to rely on trusted adults. Adults that show them that the world is not such a dangerous place, that is able to negotiate the distress, that is able to mimic for them or offer an opportunity for them to learn about how to display anger, how to revel in happiness, and how to form connections with other people. We often neglect fathers, undermining the transition that they have to consider when their wives or partners become pregnant or when they decide to bring in a child. What is really important to remember is that the parent or the significant other of the mother may actually have a mental state that influences the mother's mental state. So fathers or the significant other caregivers are not just important in pregnancy to buffer the mom's mental state, so to negotiate her anxiety and her stresses, but also postpartum, fathers play an essential role in negotiating the stress in the postpartum period and reducing risk to the developing infant brain. How does this happen? A mom's mental state influences a dad's mental state and vice versa. And this is important because this constant interaction between a mom's responsiveness and a dad's responsiveness together gives a child a holistic experience of what nurturing care is. We also know from recent studies, especially in Australia, that this directly influences a child's psychomotor and emotional development. It is equally important for us to be asking, what are our partners really feeling? Do we ever take the time to ask, how does it feel now that you have negotiated your time with the baby? Has the partner been adequately prepared for this transition? Have you noticed that your partner is feeling like they need to almost compete for attention between a baby and a mum? All of these things are important signals for you to notice in order to accommodate the partner, the transition, the ambivalence, the uncertainty, and to prevent fathers or other significant others from using externalizing strategies. By external strategies, those mean things like engaging in addictive behaviors, engaging in somatic complaints, having their own experiences of depression, anxiety, feeling as if their role has changed, not feeling as if they are part of that developing baby's lives. So in summary, the idea is to ensure that there is consistent caregiving between the parent, the father, the significant same-sex other, the grandparent or the nanny, so that we are ensuring that the baby gets one united message to allow them to have a truly balanced view in terms of what their nurturing care in this environment is meant to look like.